All right, so as of November 2022, the Montreal Children's Hospital received the necessary funding to have the first formalized transition program. At our hospital, it is called the Pediatric Adult Transition Hub. In French, it's l'espace de transition adulte-pédiatrique. As you know, my name is Christine. I'm a transition consultant for PATH-ETAP. I'm also an OT with experience in both the private and public sectors and across pediatric to adult healthcare as well. So prior to this role, I was actually working at the Royal Victoria Hospital with adult patients. Just to give you an overview of what will be discussed today, a quick glance at the difference between transition versus transfer, which I am sure many of you are already familiar with. And then we'll look a little bit at transition care at the children's and across the MUHC. I'm going to walk you through adolescence and early adulthood, what the development looks like and how that impacts our program and what the implications for care are. And then we'll further look at the guidelines for healthcare transition that we use to support our interventions, shape our program, and then really dive into what our service can actually offer within the context of the Montreal Children's Hospital. So for most of you, you know this already, but transfer is really a one-time event. It's the official shift of responsibility from a pediatric provider to an adult one. Meanwhile, transition is a longitudinal process. It can take many, many years to ensure that transition is properly coordinated and that the patient is properly ready for all the skills and responsibilities and changes that will happen as they start care in the adult sector. The trajectory to adult health care is different for every patient, for every specialty, for every provider, and from one site to another. Okay, so why transition? Why is this so important to us at the Montreal Children's Hospital? And of course, across Canada, approximately 700 patients at the Children's transfer from pediatric to adult health care every year, half of which have complex health condition. There's been more attention on transition efforts simply because a lot of these children are living well into adulthood, especially those with conditions that have their onset in childhood and were previously considered fatal. With that, there's, like I mentioned, there's an increased number of transfers to adult health care, and this might mean greater complexity in coordinating the necessary services to ensure that they're followed by the correct specialties on the adult side. And of course, it's a very emotionally vulnerable period. Transfer happens at 18 during the middle of a time where risk-taking and impulsivity peak. Many psychiatric disorders have their onset, and the suicide rate is high. Ideally, the age cutoff would be a little later on, and there is a lot of information in the literature suggesting that adolescence should be redefined as anywhere from 10 to 26, just to give a little bit more of a grace period to the teens that are going through this period, and less of this kind of rigid expectation on them to be properly independent adults by the turn of 18. So if we're looking at the global objectives of transition support and what really resonates with us at the Montreal Children's and with PATH-ETAP is building the responsibility when it comes to self-management for our teens and our young adults. As much as possible, we want to promote their understanding of their health condition. The greater the health literacy, the better they are able to make smart decisions and ultimately navigate the adult healthcare. Of course, we want to build their skills for healthcare navigation as much as possible, and we want to promote self-advocacy and independence throughout the entire trajectory to adult healthcare. Okay, so just a little quick glimpse, actually it's a bit of a long glimpse into the adolescent development. We often suggest introducing the topic of transition and transfer to patients as young as 12. At this time, between age 11 to 13, we have the onset of puberty. Concrete thinking is at the forefront. They might start to have planning skills. They're increasingly influenced by their peers. You might see mood swings, and they're in high school, or at least are starting high school. What does that mean for us when we're working with them? Well, they might fear rejection from their peers, so they might come up with ways to minimize their health condition. They might be at greater risk of social isolation. So this is something that's really important to look into as well. And also, this is when you might see refusal to adhere to treatment or to medications, which of course is a big flag for professionals when we're intervening or providing them with care. Ages 14 to 16. Okay, so this is when, depending on how they're developing, you might see the emergence of abstract thinking and independence. There might be greater flexibility with future planning, a better understanding of next steps, but also at the same time, body image may become a greater issue. They may be increasingly susceptible to peer pressure. You might notice greater parental conflict. Of course, I'm sure many of you have noticed this if you are a parent of any teen, and there's more risk taking and more interest in sexual activity. Usually this might mean difficulty understanding and accepting their limits, which again can be really hard for the family and for professionals to provide recommendations that really gel with a young person. They might deny their health condition or their current state. And a lot of it is to try and feel more normal, to fit in, to not be attached to any stigma around health conditions and disability. And at this time, you might notice more tension or friction in the rapport with teens and the types of treatments or interventions that you might be able to recommend to them. Okay. All right. So reaching age 17, 18, this is when we're looking at a transfer to adult healthcare. For those who are typically developing, who may be more or less on track with their milestones, you might see greater sense of identity, a stronger need for autonomy and independence, heightened abilities to think abstractly, to plan, to delay gratification and make decisions. There is something called hot cognition, and this directly impacts how well they are able to make decisions. So their frontal cortex is still very much developing, and their limbic system as well is rapidly developing, and so emotions might really dictate how they make their decisions. And this is at the time when they need to navigate pediatric transition to adult healthcare. It's not an ideal time with everything that is going on. If we're to look at what this might mean in terms of implications of care, for some, it might mean greater ability to facilitate self-care and adherence. For others, they might become more aware of their peers' opportunities versus their own limitations, whether real or perceived. They may face the fact that they'll have different college and employment opportunities, and they might feel even more aware, more attention might be placed on limitations that they're experiencing in their daily activities. Other issues that might come up is resenting dependence when their peers have independence, perhaps losing their parents' attention to their medical needs with the assumption that they should be independent by the time they're 18. And then with the start of post-secondary pathways, whether it's first job, volunteer experiences, CEGEP, or whatever else, they might have decreased structure to their lives. Usually this might translate to a tendency to minimize their condition, avoiding their medication, disengaging from medical care, and failing to show up for appointments. And I see this a lot with the young adults that I work with. They tend to have a good record of showing up to appointments through most of their teen years. And then something kind of interesting happens at the start of 16, 17, and well into like the early 20s. It's just the communication drops off. They're not coming to their sessions. And it's hard to pinpoint exactly why. But our program is very much focused on finding resolutions for that, or solutions for that rather. So, okay, they've transferred to adult healthcare for most. And the goal would be for them to not just transfer into adult healthcare, but to really integrate into adult healthcare. Challenges at this stage will be reflective of what might have been going on in the earlier stages. So if they were doing well in the previous stages of development, the chances that they navigate adult healthcare well and are responsible is greater. But of course, if there's been a pattern of non-compliance, non-adherence, difficulty to express themselves or to forge pathways toward greater independence, you might see greater challenges in adult healthcare when, of course, also they are technically independent to make their decisions. They might not want to include their parents in decision making, and things can get really challenging and finicky here. When we're looking at ages 21 to 25 plus, the literature does show that it's actually very similar to in adolescence, and that it's a very nonlinear path to independence at this point in time. Some young people might be very focused and goal-directed. Others might have some difficulties finding their way in the world. And at this time, they're also juggling new interests as well. There's like competing life demands, whether it's exploration of love and relationships and family. And also, much of their experience will be shaped by their financial resources, um, you know, the expectations from their family, from their culture, from their community, their cognitive ability as well, and their mental health status. Just a little bit more what this means for implication of care. Um, some of our young people find it really difficult to manage the early demands of adulthood. So balancing medical needs, education, and employment. Sometimes this results in increased deterioration and decreased health. They might also feel more isolated with increased differences compared to their peers. And what they really need is increased coaching and support, more mental health services, and ways to comfortably, safely disclose their health condition to friends and family. With that said, and in recognition of all that is going on during the adolescent and early adulthood years, we want to start transition planning very early. So as mentioned earlier, we're looking at ages 12, even younger than that, if feasible, or at the time of diagnosis. Work with your healthcare providers to create an individualized transition plan. And then, of course, we want to provide support immediately before the transfer and ensure ongoing support after transfer. So as a group, PATH-ETAP really strives to meet all of these 4 core principles. Additionally, if we're to look at American guidelines, we're looking at very concrete objectives with clear deliverables. So informing families and patients about a policy regarding the transfer to adult healthcare, again, as early as 12 to 14. So 2 years ago, we were able to create a hospital-approved policy that has since been distributed and publicly posted around the children's. And tracking and monitoring their progress, their understanding of their health condition, how much responsibility they're actually able to take versus how much their parents start around 14 to 18. I can show you in a little bit the transition tracker that we have developed. And then, of course, using a variety of tools, whether informal or formal, to assess their self-care skills. Of course, for teens who have cognitive deficits or developmental delay, this is a time when we really want to activate increased support from the community, and start looking also at the necessary paperwork for guardianship or any sort of other accommodations they might need as they traverse into adulthood. It's sometimes hard, but the planning piece and ensuring healthcare providers have a medical summary that is shared and that is sent over to the adult side. This is really, really important. So for parents, sometimes you might have to emphasize this point, advocate this point. On our side, what we're doing to address this issue is we've also created a 2-step transfer package that clinicians can follow. When we're looking at transfer of care, that's at age 18. So like, as you can see along this timeline, a lot of the bulk of it is done on the pediatric side. And then the second half is really designed for the adult side to pick up. And that's ensuring that the transfer is done successfully and that the patient and their family are well integrated into adult healthcare. Some challenges with transfer that many of you may know about or have faced yourself is the challenges of finding a family doctor or being assigned to a pediatrician. That makes it that much harder to have that additional medical home. Ensuring that tools are bilingual. So although this presentation is given in English, I want to reassure everyone that any work that is done by PATH-ETAP, any of the resources, booklets, website are completely bilingual. And then also, are the teens actually ready for transfer? Often they are not. And it's just unfortunate that the transfer is based on chronological age versus developmental stage. And there can be a long wait for the first appointment with their specialists. So, about PATH-ETAP, how are we addressing some of these issues? How are we integrating some of the core principles and guidelines for smooth transition processes? So, we're a small team of experts in pediatric adult transition. There's myself, as you know, we have a child life specialist as well. Her name is Karina. And our program is overseen and managed by Jordana Sada, who has a background in nursing, and she's also our senior advisor for all patient experience programs. Our vision is really for all teens to feel empowered in their journey to adulthood. And then in collaboration with healthcare teams, we provide teen patients and their families with tools and hands-on guidance to successfully cross over from pediatric to adult healthcare. So we work directly with clinical teams to help them achieve specific objectives and benchmarks in transition care. That's one arm of the program. And then based on the feedback from that program, it became clear to us that we also need to develop services and interventions that directly supported teens. So we have workshops for teens. Our last round just finished. It's a 3-part series. It's all about promoting self-advocacy in teens. They have the option of navigating the hospital from the children's to the RVH to really get a sense of the steps involved in transfer. And then we had a speed mentoring event as well, where they could meet a variety of adults at various stages of their life and to really be inspired about what their trajectory might look like beyond a health condition and disability. And then, of course, we provide direct one-on-one support to patients and their families. So just a quick glance at what we do with teams. We assess their healthcare transition activities, and then based on the results from the assessment, what the strengths are, the limitations are, we set goals to achieve benchmarks in transition care. We've worked with a lot of different teams now at this point, and it can really vary what the support might look like. It might be developing a consistent and systematic use of specific tools like a transition readiness assessment or registry. It could be providing individualized education and guidance. It could be embedding ourselves in their clinic as well and introducing the topics of transition and transfer to patients. So it's very variable. But what we're really looking at is building capacity for transition care across the children's. For instance, we worked with pediatric oncology, and in doing so, partnered with adult oncology to fortify a bridge between the two sites, with a nurse navigator on the adult side who could welcome pediatric patients as they moved over, and with very clear steps as to the types of skills that need to be developed and the types of things that need to be done to ensure a proper transfer. They also asked for a transition tracker, something that helps them keep readily document different types of activities related to healthcare. So things that were important to them were enregistrement to a family doctor, discussion of a medical history, how to promote more independence around their health behaviors, and planning for transfer. So this is what we created. I'm not sure if you can see it, but as outlined here, there's a general introduction to transition, and clinicians can keep track of the number of times they might be introducing the topic or sharing a policy or introducing a gradual age-appropriate shift in responsibility. There's a section on clinical assessment and additional referrals that need to be made. So we have our own transition readiness assessment that we use with patients to help gauge where goals need to be set. In terms of patient knowledge, we're looking at whether they can name and describe their medical condition and giving them ample time to do so. So across many, many years, we want them to be able to provide a brief medical history, to know and describe their medications and or treatment plans. So this is really for clinicians to use. They can quickly check off what they've covered per appointment, per visit, and what is going well and what isn't. As mentioned earlier by Justine, these booklets will be distributed after today's session, but we also created booklets specifically for teens to learn more about transition and to also familiarize themselves with the language and the concepts and the steps that are involved. Sometimes when you ask them, do you know anything about transition? Do you know anything about transfer? What kinds of responsibilities do you realistically think you can take on? They might look at you blankly because they haven't been involved in these conversations before and aren't really familiar with um, the different themes and the different concepts. So by having a booklet, not only does it normalize the experience that all teens are learning how to transition to adult healthcare, but it also provides them with clear exercises and learning sheets about what will be going on in the years to come. And then from that, they can reflect on questions they have. So and then we have a similar mirror version for parents, covering slightly different topics, but really for them to best support their teens and the learning about transition. So we show ways for parents and teens to share responsibility, how to teach specific skills, as you can see here. We have a specific task list or to-do list for parents of young people who will need lifelong support. It says 14 to 15 here, but it continues well into 18. This version is very much inspired by a working document previously made by Heather Davies, one of our nurses. So yeah, we're looking at things like, ensuring you can get a copy of the medical record, registering with a family doctor, obtaining a social insurance number. Is a psychological evaluation required? Yeah, and all sorts of other legal types of paperwork and medical exemptions and adapted transport and financial aspects as well. For some parents, it's helpful to have visual, concrete ways of breaking down a goal with their teen. So in this example, the teen might want to go to their appointment alone. How can you break that into simple steps, maybe starting with one at a time, and kind of an agreed upon way of achieving this goal with the teen? So we have examples of ways to structure learning as well in the booklet. And of course, you can always reach out to us as well if you need ideas or need support. And then when we provide direct transition support to patients, so this is the referral criteria at the Children's, where you're looking at patients ages 14 to 17 plus, specifically those with difficulties with independent self-management. We're looking at ones who need support with development of decision-making skills, who might be impacted by psychosocial factors, and who are at risk of loss to follow-up, non-adherence, non-compliance in adult healthcare. Usually when we first meet our teen, to avoid overwhelming them, we might introduce the idea that there are differences between pediatric and adult healthcare and just kind of see how much they know about it. It's usually just an informal conversation. Usually they are unaware that services are divided by specialty and are at different locations in adult healthcare. It's also new to them that it might be a much more structured, less inviting environment, that typically they are expected to be responsible for their own medical care. Often I'll speak to teens and when I ask them about adult healthcare and how much responsibility they're interested in taking on, they might say, well, why? Mom's going to do it for me. What's the point? So the shift in expectations might not yet be fully clear to them. So we usually start with just an introduction to those differences, just to spark a little bit of reflection. Then once they agree to actually work with us to build their transition readiness, we have a variety of tools that we can use with them to screen and assess their transition readiness. So some teens, I've worked with teens who have an autism spectrum disorder, for instance, who much prefer a clear stepwise explanation of the skills that are required to be more independent in adult healthcare. So this is the one that you see to the left called transition timeline. It gradually builds, each skill builds on the next over time. It starts with on your mark, get set, go. It's very progressive and gradual. And then others might prefer something a little bit more open-ended, more reflective. So we have the My Self-Reflection tool that can also be a very, very useful way of sparking discussions about transition and transfer. I like using these a lot. Usually once the teen goes through the timeline, sometimes it might be like, I think I'm doing things fine. I don't really think I have anything to learn. But then as they go through the timeline, they're like, well, actually, I don't know if I've started a process to find a family physician. And well, actually, no, my mom helps me take my medications. And um, I actually don't understand how drugs and cigarettes and alcohol might affect my health. So it's a really good way of flagging to them as well where there might be gaps in knowledge without necessarily um, confronting them about it. Our interventions are multifold. We work a lot on self-advocacy skills. So this might be role playing, this might be practice of the 3-sentence health summary, this might be teaching about efficient communication styles. When it comes to self-management skills, as you got a glimpse of earlier, it's a lot of goal setting, practical skills that we can help them achieve or acquire rather. We work on them with problem solving, learning how to balance their life priorities, how to conserve their energy. And as much as possible, we try to simulate functional tasks, partially achieved in the workshop, as I mentioned. With healthcare navigation, very much we offer them a gradual exposure to the adult approach. Most of my experience does come from the adult side, so I just kind of fly with that. And then we orient them to adult healthcare as much as possible. So that might mean actually walking them through the hospital, showing them where admissions is, how to get a hospital card, etc. Psychosocial support is integrated throughout. A lot of the flexibility around building skills and having a bit of that growth mindset is also contingent on how much self-awareness they have about their own limitations or their own development. So as much as possible, we try to build self-awareness. And then from there, we can develop appropriate coping strategies for the individual in question. We have a child life specialist who really takes the rein on psychosocial support, and she can also provide support for medical procedures. And then we have our workshops. So we have the Rock the Boat series, which is all about self-advocacy. We have adulting skills, which is about budgeting, cooking, and any other types of independent living skills. And then last year we went to a summer camp that was organized for rheumatology patients to talk about transition. So this is a 3-sentence health summary. It's an easy breakdown of what needs to be discussed. So the first sentence, my age, my diagnosis, my medical history. The second sentence, my treatment plan and medications. And then the third sentence, my questions and concerns to talk about during this visit. This can take some time for teens to feel really comfortable spelling out and even explaining out loud. So that sometimes is the bulk of our sessions as well, just working on the 3-sentence health summary. The navigation map that I shared earlier, we work on this one a lot too, specifically with visual learners. And it builds on the idea of taking a task and breaking it down into smaller steps to make it feel a bit more attainable. Some quick tips: ask the teen for their input on things. What is their experience with transition and using the healthcare system? And also, what are their hopes and dreams for the years to come? Méthode de la voiture. This is something that was shared with me by a colleague, but just kind of, when you're sitting side by side or just kind of talking to them casually, that's where you can actually get so much information and also build a bond. So we really try this approach when we can. Ensure that they're registered with a family doctor. As much as possible, we want to include their parents in the process. Sometimes when teens do start working with us, they want to do so independently because it's like a real chance for them to go to these appointments alone when they might have been in the habit of doing it with their parents. But when we can, we do involve parents. And one of the ways we've done it is, having the teen and the mom in the same space at the same time, and then gradually fading mom's presence from the session by increments of 5 minutes at a time until the teen felt more confident and mom was also reassured that their child would be okay in the session. A lot of it is trial and error with running this program. Many learning lessons so far. And then just some takeaways. On the pediatric side, start transition planning early. This is really for clinicians and for families. Assess transition readiness regularly. Activate supports to promote as much independence as possible by age 18. And then, as needed, focus on a caregiver approach, especially for young people who might not be independent into adulthood. whether it be for cognitive or psychosocial or developmental reasons. And then with adults, on the adult side rather, we want to ensure that transition support is provided well after transfer, that young people are properly oriented and integrated into adult healthcare. As much as possible, we want to assess self-management skills and consider healthcare navigation as an instrumental activity of daily living. This is a very OT lens here. And then we want to recognize that a subset of youth will not require health literacy and will rely on capable caregivers for care. So how can we activate that support from an earlier time point? And on the adult side, we need transition champions. We have many of them on the pediatric side where we're looking for them on the adult side. And that's it.